Now it's time for Wellness, and on Wellness Central today, the death of Dr. Oluwafemi Rotifa at Rivers State University Teaching Hospital has become more than a personal tragedy. It's now a symbol of silent crisis plaguing Nigeria's healthcare system. He reportedly collapsed and died after working a 72-hour shift, the only doctor on duty in a busy emergency ward. His colleagues and the Nigerian Association of Resident Doctors say this was not an accident, but a predictable outcome of systemic neglect. Too few doctors, too many patients, and no real safeguards for rest and recovery. Doctors across the country are describing a pattern of exploitation, long hours, poor pay, insufficient insurance, and little recognition, all while being asked to carry the weight of a collapsing health system. Many say they are treated as expendable, not essential, with endless appeals of fair working conditions ignored until tragedy strikes. It's no surprise that thousands leave the country every year, part of the ongoing japa wave that drains Nigeria of some of its biggest and brightest medical minds. What remains behind is a vicious cycle: overstretched staff, underfunded facilities, and patients who ultimately bear the cost.
And the calls for reform are urgent and pointed. Regulate working hours, improve manpower planning, offer competitive pay, and provide health insurance that actually covers medical workers. Without these, the system continues to fail not only the doctors but also the citizens who depend on them. Today, we examine why this crisis persists and what it will take to stop more lives from being lost, both doctors and patients. And joining us now is Dr. Benjamin Oluwatosin Olowojebutu, I hope I got that right, National First Vice President of the Nigerian Medical Association. And we also have Dr. Alamin Usman. Thank you, gentlemen, for joining us. Good morning.
Morning, gentlemen. Thank you very much for joining us. Let me start with Dr. Alamin. Thank you very much for joining us, Dr. Alamin. Let's talk about the situation here in Nigeria before we refer to the specific case of Dr. Rotifa and his death. What are we faced with here in Nigeria after so many years of a brain drain situation? What are we left with, Dr. Alamin?
So thank you so much for having me and for that wonderful question. As you have described early on, Nigeria has faced long term of unregulated, doctors having unregulated working hours for a very long time. And we have been talking about this for a very long time as well. The Medical and Dental Council of Nigeria is the organization that has been saddled with regulating the practice, ensuring safe healthcare, from the doctors towards the patients as well. And for the past 62 years now, since the inception of the Medical and Dental Council of Nigeria, it has looked at every aspect, regulating the whole practice of doctors in Nigeria. However, it fails to look at the most important one, which is the working hours of doctors. So you find, doctors in Nigeria all these years, every single doctor who has gone through, periods of excessive and unregulated working hours, which has detrimental effects as well. And in the same phase, you find doctors not, earning what is adequately, that reflects, the working hours that they have worked. You have doctors working on average 106 hours a week, and more than 400 hours a month. However, at the end of the month, you find most of the doctors earning less than 250,000 naira. So when you sit down and try to figure out how these working hours equate to the number of, the salary that they earn, there is no reasonable explanation for that. So this exploitation by employers as well has gone on for several years, where doctors would just be placed on call, for 72 hours, 96 hours, and just because they can take it, hospitals would be short-staffed, and at the same time, hospital would not employ more doctors because there are doctors available who could, run the hospital, even though the hospital has severe shortage of doctors, and that has been the case in Nigeria, and is one of sorrow and pain, to be honest.
Right. So, Dr. Benjamin, let's talk about the case here, which is the death of Dr. Rotifa. How was your reaction, and how much does this reflect the day-to-day reality of Nigerian doctors? Dr. Benjamin.
Good morning to you. I'm happy to be here again today. It's a very sad situation in the country. We all know that WHO has told us that the ratio of doctors to patients has dwindled in the last 3 years in this country. We have one patient to about 10,000 patients. It means when one doctor dies, or when one doctor relocates, we lose the doctor to take care of 10,000 patients. So do the extrapolation. You now have one doctor doing more than three people's job because of the lack of regulation. So I appreciate what Alamin has said. You know, the Medical and Dental Council of Nigeria also try to regulate the working hours of doctors. Let me give you a scenario. A doctor does a call from 8 p.m. till 8 a.m. in the morning, and he's still expected to work from that 8 a.m. again till 4 p.m. in the afternoon before he goes back home. It's very, very sad that we are overworking the ones that are left in this country. I always say very easily. The population should also understand what the doctors are going through. If, for example, you run a clinic that lasts between 8 o'clock and 2 o'clock every Tuesday, you can stagger the patient and give them more time, so that you don't overwork the doctor and split their time into appointment. But now, because most of the hospitals are driven by profit, driven by number of patients they see, they don't mind putting all the patients on 1 day appointment to overburden the doctor. So the situation is very, very bad. It's very, 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 very bad. We are losing doctors every day. People are getting more ill. We are having people having chronic medical illness now. You have doctors going for dialysis every week, every month again, because of this very, very, very severe and very, very bad working environment. So it's not just the inadequate, the long hours, even the inadequate welfare package of the doctor. So you work this hard, you work so much, and there's no money. There is no money. You can't go on with good salaries for your families to see you. So you work hard, and you have nothing to show for it. So for me, it's about all of us consciously asking the right questions. The media, the government, the patient, supporting what the doctors are going through and saying, no, enough is enough. You cannot earn $6,900 in 2009 per annum. Now, because of inflation and devaluation, you now earn about $700 per month per annum. That's very, very, very ridiculous, because it doesn't make any sense to anybody living and working in this country. So MMA is very, very passionate about the working hours of doctors in this country. All of us need to speak up and speak the truth.
Now, Dr. Olu, now you just hinted on something that I wanted to find out about. What is health care like for doctors themselves, since they put themselves through so much? We know that we go through so much when it comes to our health care, but we always think that doctors have it at hand. But what is it like for the average Nigerian doctor?
So it's not very true, my brother. Doctors are also human beings. They are not just doctors and they live in another alien world. We are medical doctors, we are human beings before we are doctors. It is very painful that sometimes there are no adequate infrastructure, adequate insurance for us doctors in this country. And we just work until we drop there. So, and most doctors who don't take care of themselves because they don't understand that there's a time to say, I can't work again. Because of our Hippocratic oath, we are driven by love, we are driven by compassion, we keep working to take care of the patients, and we forget to take care of ourselves. So it's important there's a structured way that government should help us structure it, so that we're not also caught in the challenge of not getting adequate healthcare. Let me give you a scenario. When you have accident in this country, as a medical doctor, you pay from your pocket. You can imagine paying from your pocket, and that's a lot of money. You have a fracture that costs about $10,000 US. How do you raise that kind of money? So it's important that there is a package, there's a responsibility of government to give insurance to all the doctors in this country working and in this country for now, because we are short-staffed, so that there's a regular checkup that is aligned maybe with the birthday of the doctor or with the particular day of the year. That a doctor is free from work and goes to do a medical checkup to know what's going on with the person at a particular time. Most times, until the doctors fall ill, we don't know what's actually wrong with them. So I am pleading with the stakeholders and regulators, help us fashion out a medical examination day for all doctors working and living in this country to help them see what their health condition is. We call it health promotion, not only for the patient, also for the medical doctors. Thank you.
So, Dr. Alamin, I would like to know how, this relentless, ongoing, recurring schedule affect a doctor's ability to treat patients. We understand that, you might be fatigued and all, but just give us a view as a doctor. How will it affect the ability of a doctor to treat patients safely and compassionately?
So, thank you again for that question. We're all doctors, me and Dr. Benjamin right here, and we know the effect of stress on the human body. And as a doctor as well, that effect is not excluded on us. When you get fatigued, when you're sleep deprived, when you're tired, it clouds your judgments, clarity, in making decisions about a patient. So we can deduct or deduce from that when a doctor is tired, his ability to make decisions are not going to be straightforward or very clear when it comes to the patients.
Right.
A patient would come to you and, at a time when you've gone over 72 hours duty straight, when you started, the decisions you will make about a patient are going to be different when you are at your 72 hours or 96 hours. And that would definitely affect, the outcome for, the treatment outcome or the management outcome of that patient. And I will tell you this has gone on for several years, and we're just living in a country where litigation is not really that much right now. And patients are not really aware, of whether they could complain about the services that they have received. And that is why this thing has gone on for several years. If patients become aware, then I tell you, you will find a lot of medical errors that have been, that has gone on in the medical healthcare system in Nigeria, and which is a direct result of this unregulated and heavy and excessive working hours, the burden that is on the doctors. So until we come and, realize the effect of this, excessive working hours and the effect it has on both the doctors and the patient themselves, we're not going to have a better healthcare system in Nigeria, to be honest.
Thank you, Alamin. Dr. Benjamin Olowo, I'm wondering whether there's a connection here. The brain drain that we're seeing in the Nigerian system, doctors going to the UK, to Canada to ply their trade and leaving us here with, well, whoever is left. What should the focus be now? Should the government be trying to stop doctors from looking for greener pastures, or should they be providing for the remaining doctors that are here? What's the best step to take when it comes to policy reform, especially for the medical sector?
So in the japa syndrome that has happened, that has plagued our doctors in the last few years, there are pulling factors and there are pushing factors. Pushing factor meaning the environment we work in this country is not very, very enabling. There are a lot of things happening that doesn't sit well with the doctors or make the work very, very easy for us. I said it before, inflation has eroded all the kind of money we had. In the last few weeks, we almost went into a very, very bad strike that will have affected a lot of things in this country. But fortunately, it was averted because of few interventions that NMA took with the government. But that did say we need to have constructive, concerted policies that retains doctors in this country with good welfare packages, enable environment, instruments to do the work, a good security system. Issues that affect doctors. Doctors must be taken very seriously. We can't have doctors owed salaries for over 18 months and not being paid. Those things are not very, very encouraging for doctors in this country. You can't have that you've signed with people since 2001, 2009, they are not obeying them. You are not implementing them. Doctors don't have their own insurance scheme in this country. But now I applaud the federal government. We just saw a notice day before yesterday that the president has announced that all civil servants in Nigeria should be registered under the NHIA for insurance. But most times those insurance, they're not premium insurance. They don't help those very, very high-end diseases that affect medical doctors in this country. So for me, the environment must be enabling. Government must be determined to keep doctors in this country by paying them adequate salaries as compared to what other people earn all over the world. Make them feel comfortable living in the housing allowance, scarce skill allowance, rural allowances, teaching allowances, professional allowances should be increased according to international standards. So that doctors, why are they going abroad? It's because that place is very, very safe. They are making more money. So if we can raise that to what is expected of us in this country, they will be happy to stay in this country. So I believe government, the first policy is to try to retain doctors working and living in this country. That will help them know. That will help them know that they are encouraged, they are loved, they feel the government going forward. Thank
Dr.
you.
Benjamin, thank you very much. We're now being joined by another doctor, Dr. Osundara Tokwe. He's the National Association of Resident Doctors President. Dr. Osundara, you're welcome. Thank you very much for joining us. I want to go straight to it and ask you this question regarding what the structural failures are in the health management system and also governance. How do we allow these kinds of tragedies to continue to happen in Nigeria?
Please, kindly take that again. I didn't quite get that.
So I asked what the structural failures are in health management, in the health sector here in Nigeria. What are they exactly that are seeing us lose doctors to death?
All right. Thank you for having me once again. My name still remains Dr. Osundara Tokwe, and I'm the president of the Nigerian Association of Resident Doctors. Part of what has made, has created this whole quagmire in our health system is because of government's unwillingness to address issues concerning, the health system. And one of it is the issue of burnout that people are suffering under, and the issue of the incentives that goes to the health workforce. Most time, the incentives, the remuneration for doctors and other health workers are very poor. They are meager. You are aware that as of now, we still have arrears of salaries as far back as 2023 still being held. And just like the Vice President one of NMA has mentioned earlier, that it was just by sheer luck that we were able to avert, a strike. A strike by NMA is something that should not even happen. If a national strike should happen and all doctors shut down, doctors are not working anywhere, it is going to even affect the president himself. God forbid, if anything bad should happen to any of our political leaders, president, governors, there is no doctor to even give first aid. That is what the strike of NMA means. So it's going to affect, it's going to, put us in bad light. It's going to be an eyesore for the country.
Okay.
So like you mentioned, part of what is affecting us is the workload, the excess workload, the acute severe shortage of manpower. Several doctors are leaving because their welfare is not a priority to the governor. To the president. The stakeholders, the relevant stakeholders in the health sector, most of them are not bothered about the state of the healthcare facility, the structure and all. So it is part of what is causing this, japa syndrome, the emigration of health workers out of the country.
So, Dr. Osundari, you mentioned, workload and all that. So a lot of doctors have jackpot. They've left Nigeria for greener pastures. Can you tell us how much do doctors earn? And has there been any committee, because we like to create committees in Nigeria to have conversations that have, spoken to the government to say, see, we're reducing, we need, if at all, you want doctors to stay 72 hours, 96 hours on the call, how are they compensating you guys? Did they increase your salary? Are there compensations like Dr. Benjamin mentioned? If you get sick, you get to pay for your medical bills. Are there any ways that the government have said, you know what, we're going to increase your salary and all that?
Okay, thank you. We are actually working out something so that the remuneration will be improved. But as of now, the remuneration is still very poor. Now, we are at, part of the agreement we have with government is to see to how this remuneration can be better. And if the remunerations are better, I'm sure that it can encourage other people to come, especially those who have immigrated. Then you now begin to see that people now begin to come back to the country. Because several committees have sat. There is an ongoing collective bargaining agreement that is even happening with the government, and we believe that this will be able to address this issue. Then I would also want to refer you to the national policy on health workforce released by the Honorable coordinating minister for health and social workforce, that's Professor Alipati. And part of what is contained in the thematic area, if you go through that national policy on health workforce, you will see all of these things highlighted there. So there are several committees that have sat to address the issue of remuneration for doctors. And as of now, an average doctor in Nigeria is collecting, less than $20, because if you multiply $20 by, I think the rate presently is, I think 1,550 or 1,005. So what an average doctor is getting is too low, it's too meager, and we cannot keep, we cannot keep at this. Things needs to be improved and improved upon. So the burnout is really affecting. You wanted to say something?
Yeah, I want to say something, and I want to compare this. Dr. Alamin Usman is here, if I'm not mistaken. Dr. Alamin, where is your location, and where do you practice, if you don't mind?
I am in Birmingham.
Okay, thank you very much. Could you confirm, what exactly does the average Nigerian doctor outside of Nigeria get? Maybe I'm asking what your salary is, if you want to tell us.
So, I love the fact that this conversation went this way, and truly, to be honest, I think this is me directly to the NMA president and the NERD president, that even in the health care workforce migration, policy that has been released by the NMA, I'm going to come to that question, but I just want to set a precedent that even in that document, there is no explicitly where it mentioned that they're going to look at the work hours. And I say that we have been neglecting this issue of work hours on its own, and it is the cause of all these issues, all this strike that we've been going on. Look at it this way. Here in the UK, because they have a regulated working hour, a doctor knows exactly how many hours he's going to work every week. And he knows exactly how much he's going to be paid per hour for that work that he has done. So that means that at the end of 40 hours per week, you're going to earn maybe £1,000. And if you earn £1,000, if you're going to work any extra, then you're going to be paid compensated for that. But the problem, the issue that we have in Nigeria is that doctors work excessively. They work more than 400 hours in a month. And then if you come out and come and sit down, look at the way the conmess was structured, there is no single explanation that points out this is exactly how 250,000 naira equates to the 406 hours that the doctor has worked over a month. And that is the problem that we are having. Here in the UK, you will find doctors being paid for unsociable hours. Unsociable hours means any hours from on the week. I mean, if you work in a weekend, it's called unsociable hours. If you work any time between 7 p.m. to 8 a.m. the next day, it's called an unsociable hours. Now look, tell me how many of those hours do Nigerians work voluntarily without being paid anything? They just collectively called it call allowance. What does call allowance mean?
Dr. Alamin, thank you very much. Dr. Alamin, just a second. Dr. Alamin, my apologies. We are running out of time. I'm trying to really get to the end of this argument. Dr. Benjamin, I'd like to know how much does the average Nigerian doctor earn Dr. Benjamin Oluwo.
They also result. Can you hear me?
Yes, go ahead.
The lowest, our youngest colleague, house officers, earn about 200,000 naira, and the highest doctor earn about maybe maybe about 900k, 800,000 naira. So compare the amount of money in dollars or in pounds. Look at what Alamin is saying. A doctor earns 1,000 pounds in a week. That's about 1.5 million naira in a week. Multiply that by four times, that is 6 million naira a month. That's a young doctor. But whereas a young doctor in Nigeria earns just 250,000 naira in a month, 6 million, 250,000 naira. So where do you want the doctors to go? And as he has said, there is no place in that policy of health retention policy that shows how the doctors that are living and working in Nigeria will their salaries be improved, and how would their salary be improved per year or per month or per workplace, or how would they be compensated if they work so hard? So it's important we address the issue of welfare in this country. If you don't pay doctors properly, they will not work well.
All right, thank you very much. Dr. Osundara, please, if you'll just be summarizing your final take here regarding the disparity in pay for Nigerian and foreign doctors. Please be summary.
All right. I think something needs to be done, and that should be done urgently, because there should be compensation for the excess workload. Let me just address something. What we do as call duty is that once you start your work from 8 o'clock to 4, you don't have a time to rest. You go into your call duty, and sometimes this call will last till the following day, and it can continue in that way for 72 hours, sometimes for months, and you are just perpetually on call. And nobody is going to pay you for excess working hours. Nobody is going to pay you for the stress. Some of this stress is going to cause emotional damage to you, psychological damage, mental breakdown, physical breakdown, and eventually what you get to see is that the doctors are depersonalized. They become cynical, negative attitude towards your colleague, negative attitude towards patient. And in the event you discover that there is assault, doctors and patient fighting, there are several cases of assault that you've seen, because these doctors are human and nobody is attending to them. So in short, I would want the government, especially because this CB has been convocated, to look into the issue of excess working hours. Pay for that time that the doctor has spent in the hospital. And beyond that, there should be policy that safeguard doctors from excessively working, so that the doctor will not misdiagnose when he's treating a patient, or will not do a wrong thing. And I wanted to correct something I mentioned. I mentioned $20 or so. So it's $200 I wanted to say, so that it will align with what
I figured, because we calculated 30,000 naira.
Yeah, it's just about 30-something thousand naira.
Yes, thank you very much.
Thank you so much, gentlemen. Thank you, Dr. Alamin, Dr. Benjamin, and Dr. Osundara, for joining us and giving us insight as to the lives of doctors and why we have a lot of doctors leaving Nigeria. If I was a doctor, I'm sure I would have left. But thank you, gentlemen, for joining.
Thank you very much.